and I'm going to start the recording now. And okay, great, that's working. And I got to share my screen. So let me know if you see my screen. Does everyone see my screen except for Tammy?
Yeah.
Yes.
Okay. And all right, so what I'm going to do tonight is just go over some of the determinants of learning. I've broken it up into 4 parts just in case we don't get to all of it. And I did that last year simply because it was easier for me to manage, depending on the number of questions we have at the beginning of the beginning of the class, that kind of thing. And hopefully we can have a discussion about. I'd rather have a discussion about some of these things rather than just go through the slides. But give it a second to come up. Okay, I got a blue screen. That's not good. No, I don't want to do that. Oh, there we go. All right, come on, move. Okay, so this week you're doing learning objectives, and you're expanding on that concept a little bit. I know y'all did some learning objectives last week, and again, I don't know why this is not going fast enough here, but either I'm impatient or it's going too slow. All right, so one of the things that I saw I'll just go ahead and talk while it's coming up. One of the things I saw in some of the work this past week was how they were worded. So we generally begin, for example, like students will be able to, or participants will be able to, and then have an action verb, in this case, recognize the principal goal in learning. And this is really going slow. Here we go. All right, so students will be able to properly recognize the level of Bloom's taxonomy to use in the final project, because that's what I want you to be able to do. And students will be able to select the appropriate terminology to develop the objectives, because when you're building your presentation, when you're building your capstone, you want to have an endpoint, and the endpoint, of course, is to accomplish whatever goal you want to. But how do you get there? You get there by achieving the learning objectives. So word it every time. What we sometimes call swabats, which is students will be able to, the S, the W, the B, and the A, and the T. But you can also do the participants will be able to if you were doing a presentation, say at a conference or something. Either way, it's fine. And remember, we've already talked about this, but what is your perspective? Are you going to be using andragogical principles, pedagogical principles, or are you going to be sort of using a mix of those, remembering your audience? So if you had a patient scenario, what do you think you would lean towards? Anybody? Would you lean more pedagogical or andragogical?
I'd probably go andragogical.
Yeah, same here.
Okay, so how would we do that with a patient? Well, one, they've got background in their own condition, right? And they know their own bodies. Sometimes they may not know that, and we may need to educate them on that process. But if we can draw off of their experience, then I think we would have a much better chance of letting it sink in of what they need to do. There may be a time, if you were doing, for example, a group type session, that you might have to switch back towards more of a pedagogical, but then somewhere in the middle of the presentation, start getting input from those learners, because having them share their information, they can help learn from each other. So remember, pedagogy is sort of a combination of these two. So there's not an absolute. I mean, if you talk to Malcolm Nowles, he might tell you there is, but the reality is there's going to be sort of this back and forth that you might experience depending on, like, for example, a new topic, how you might have to construct a new topic for a student. So your role is learning. Your role in learning is multifaceted, and it may not be exactly what you think. You actually have to first As Socrates says, know thyself. Because the more you know about how you learn and how you teach can help match that with what the student needs to do. In other words, a lot of times what I've seen in educators is that they know the material, but they don't really know themselves how they actually learn. So get to know yourself a little bit about that. Now remember that in your textbook, we have to, it sort of describes the process. And just like our patients, we have to assess the patient and reassess the patient. There's this sort of constant evaluation process that goes on. We assess them when they come in, we give their treatments, we reassess them, we reevaluate them. They give us feedback on how they feel, et cetera, et cetera. Same thing goes with education. There's no different. The only difference is that as an educator, you're much more involved in establishing those objectives and those goals and giving that feedback and being more directive in terms of how you can help that student, patient, or staff member. But there's this sort of this constant back and forth, and it's if you teach or if you have taught, you know that it doesn't stop when you get to an end. There's I hate to say this, but there's really not. I used to tell my students, there's not an end point here. You are constantly going to be learning, and if you are not learning, then I'll give you this little tidbit. Have you ever heard this quote? If you're green, you're growing. If you're ripe, you rot. Does anybody know who said that?
Sounds like a Mark Twain.
Well, not quite, but yeah, it does sound like that. It's actually Ray Kroc. You know who he is, right?
McDonald's?
Yep, founder of McDonald's. He failed at every business until he discovered how to market a hamburger. And but that was one of his quotes, and I always liked that, even though I don't eat at McDonald's. I thought, hey, that's a really interesting quote, because the reality is, and you can all see this in your staff or your students, once they get jaded, they stop learning. They just seem to not perform at the level they should be, and that's horrible for professional growth, profession, and the profession as a whole. And if they constantly, that's what I love about going to conferences, because most of the people there are there to learn and they're excited about it, and I get excited about that. So step one, you're identifying the learner in your process. So whatever your learner is in your project, you have to identify that, because you're going to have to choose what setting to go into. How are you going to present this? What are you going to do? You're going to have to collect data from that learner. You're going to have to find out what they need to learn, and that might be in the maybe a survey or something along that ways. But I'm going to give you some other examples of how you can achieve that. And then involve members of the team. And I was having a discussion with a student today, and one of the greatest things you can do is have a groups established to sort of brainstorm ideas, and that's sort of the way you can come up with ideas better than just doing like a pretest. Pretests are one way of well, let's just put it this way. Pretest by definition isn't necessarily a test, but it could be a way to evaluate. So we could do that through informal conversations, observing questionnaires, formal interviews, and focus groups. I personally like focus groups when it comes to problem solving, because it helps give ownership to whoever we're working with. And we used to do this a lot in the community college system. And so what we would do is we would have, I don't know, 30 faculty and staff members. They would come together. The focus group coordinator would give us what the problem was, and the problem had been identified on, say, a student surveys. The problem was in one year was online learning is not as successful as in-person learning. And so the problem was, what are the issues that surround that? So we all broke off into our groups, and we had a leader of each group that would write down all of our ideas, and then we would all come back together. As we all presented our ideas to the whole group, the moderator would then sort of check the boxes to say, we would look for the commonalities, and what we'd end up with by the end is where everybody kind of crossed over was this, what we were going to do to focus on the solution. And that's incredibly important, particularly with staff, to be involved with the decision-making process. But it can work with students. We used to do focus groups in pathophysiology where I would assign each group of students a disease process. And I would have them to do disease maps, for example. I don't know if you've ever seen one, but basically it's a mind map is what it is. Is anybody familiar with what a mind map is? Oh, all right, so lost internet connection again. Stay with me if you're there, if you can still hear me. I don't know why we lose connection almost every time at this time of night. Personal hotspot.
Presenting, but I don't hear him.
Okay.
Yeah, and I see his mouse. Oh, there we go.
Okay.
There you go.
All right. So it's something weird is going on at about this time every week. Internet cuts out. It's almost like they're taunting me.
You think?
Yeah. All right. So I was on
Do you
focus.
think that it's overloaded with homeschooling?
That's a possibility because we have that is a possibility. The load on the system is pretty high, and
Yeah.
I didn't think about that. That's a good point.
Mm-hmm.
So anyway, we were talking about focus groups and how I used them. I mentioned disease maps. Did you get that?
No,
Okay. So what I was saying
we lost
was,
you. I'm sorry.
where did you lose me?
We lost you when you were talking about the group focus
Okay.
and putting it on somebody. I calling the person that or identifying the.
All right. So identifying the problem is the purpose of using
Right.
focus groups. And when you come together and do that, sometimes it's called a group of friends. I've done a number of articles on this, but basically a group of friends is a focus group. But the difference between a group of friends is that you get together with people that you are like-minded versus somebody you're kind of thrust together with. And there's sort of a slightly different dynamic. But in any case, both of them work depending on how you approach it. But anyway, a focus group, I used to use this with my students in pathophysiology. We would do disease maps, which are effectively mind maps. And what I asked before we got cut off was, does anyone know what a mind map is?
No, I can't say that I do.
Okay. Adam?
No, I don't think I've ever.
And Tammy, are you still with us?
I am. The only thing that's popping to my head is Sherlock Holmes.
Yeah, in a way, because in that movie, it actually now kind of shows how he's thinking and how he puts everything together. That's sort of what a mind map is. But the difference is that I do more of a structured mind map, and then I allow the students to develop their own. But I would start with part of the pathophysiology, and I would describe how that, let's say for asthma, for example, you got the inflammation, the edema, the bronchoconstriction, et cetera. And then from that, I would draw a line. and I'd say, let's talk about physical symptoms. What would happen? Or let's talk about the airflow dynamics. So I would draw a line and we would talk about airway resistance or compliance and static compliance. And then, what would that cause? And so we would make all these branches about how things sort of one thing led to another, how the bronchoconstriction and the edema and all that leads to to the reduction in airflow, and we get all of this written out for them, and then we come back and we start adding treatments and what it does, and it's really a dynamic process. And I would have the students then turn around and present their focus group results to the rest of the class, and they would do it on these, I guess it was, we had 12-foot by 4-foot paper. It was huge, and we would actually tape them to the outer walls of our health science department, and they would actually be writing on the wall. Well, not writing on the wall, but they would be writing on the paper. And then we would go around like we were doing grand rounds, and they would describe what they had done. It was really a fun it was really fun. I used to love to do it because it was always during the summer that we would do that. But there are different ways you can go about, presenting information, but there's also different ways you can do about assessing the students. You just have to use your imagination as to how you want to do that. You probably read something about the gap analysis in your text, and the gap analysis is the next step after the SWOT. But basically, or it could be the one that you do first. It doesn't have to be in that order, but you're trying to identify what, it's an effective way to really go, to develop your active learning plan. So active learning is a term that you'll see a lot in education, and basically it means you get the student active in their learning process. But the first thing you have to do is assess them and to find those gaps in knowledge. What do they lack? The knowledge, the attitude, or the skill? Well, we know that's the cognitive domain, the affective domain, or the psychomotor domain, right? So you want to find out where are they lacking, and you can easily do that through assessment. Learners are unaware of what they don't know or what they want to know. As we always say, they don't know what they don't know. So sometimes you just have to, prompt them to ask questions. There's a number of ways you can do that as well. But the gap analysis is one way to assess. And so we know if you're working with staff, you know what the present performance is. And you probably know already what they're lacking. But do you know what you want to get to? So for example, in a student I was speaking to today, they wanted all of their staff members to be able to do clinical protocols. What's the gap? Well, that's why you do a gap analysis, because you don't necessarily know. Well, you had anything from baby boomers to Gen Zers in the department. Well, part of the gap is what? Age and how they approach problem solving. Gen Xers and millennials solve problems different than baby boomers. So you have to kind of look at the environment and what you're dealing with. Is it majority millennial? Or is it a majority Gen Xers? Probably not a majority baby boomers anymore, because they're all retiring. Anybody in that category, by the way, that last category?
Yes, of course.
Okay, good. I don't feel alone. So here's how it would look. So this is an example from a nursing plan. It says current state: 40% of the patients 65 and older in our community health clinic are receiving pneumococcal vaccine consistent with national guidelines. They want 100%. Their identified gap is 60%. So what do they want to do? What's the knowledge gap? People are unaware of the updated guidelines, and this, of course, is staff. So the staff would have to educate, obviously, the patients coming in. The chart audit of patient files, interviews with nurses, 75% of the nurses report they're not familiar with updated national guidelines, and we're not providing that information about vaccines. So the simple solution is to provide that information. But it can be that simple. Now, my question to you would be, do you think a desired state of 100% compliance would be, it's desired, but do you think it's possible that they could achieve that? 100% get the vaccine?
Never.
I wouldn't think.
Okay, but
And
100%
I'm
of the,
agreeing with y'all.
what's that? Oh, you agree?
I said, I agree with you guys.
So, but would a desired state, that would still be the desired state, right? And so the closer we can edge to that, obviously, is the better. But, it's maybe a little unrealistic, but the reality is that's what their goal, that's what their desired state is. One of the desired states would be to make sure that 100% of the patients get the information about the vaccine. Well, I think that's achievable because you could easily make sure that you have a checklist to make sure every patient has that information before they leave. Whether they choose to get it or not is up to them. And then there's another example here, but I don't need to read it to you, but you get the idea. I think it's a very effective tool because it kind of gets to the heart of the matter, because in other words, you're saying this is where we are, this is where we want to be, and this is what the problem is, and you solve that problem. And the actual SWOT process can help you identify other things that might impact this. One of those would be, what are the obstacles to, are the barriers in the case, if we want to apply the SWOT technique to this, what are the barriers to getting 100% of the patients 65 and older in the community to receive the pneumococcal vaccine? Well, one would obviously be religious issues, right? Religion may prevent you from doing that. Well, that's okay, but you identify that. That's a barrier, right? An obstacle might be that, your patients that are in the community may not be able to come to the clinic to get the vaccine. So how can we solve that? So these are very useful tools, and it seems like, okay, well, we're just writing things down, and we could do that without having to go through all this. But the reality is, if you write it down, you're more likely to achieve it. And what I like about the gap analysis, it helps identify the goals that you want to set. It's a very effective technique, I think. Because if you're working with that focus group, this is what you would do in your focus group, by the way. So you would take that information and everybody would, agree on all of these things. And then the next step would be to implement this program and then reevaluate this program. And we'll talk about this, I think, in behavioral section, which we're going to talk about what's called the ADDIE design, which I think is a more complete process. And my preference would be the ADDIE assessment process, and we'll talk about it next time. But I just wanted to throw that out. Let's see. Hopefully this is not going to stall on me here. Looks like it wants to. All right. So any questions about just sort of the basics behind that?
No.
No.
Okay. All right. So we'll move on. Now, the reason I have this picture here is not just to make it look good, but when we try to determine, and we talked a little bit about this with learning styles, when we're trying to determine determinants of learning are dependent on the patient, it is a patient, but also student population that we're dealing with. So everybody in this picture is different. And who was it? Somebody wrote in their paper, I thought it was a really good approach. Adam, it might have been you, used a baseball analogy. Was that you?
I don't think so.
Okay. Somebody
Unless
used
it was by accident.
Oh, okay. Somebody used a baseball analogy that, the pitcher has to determine with every batter how he's going to strike him out, and every batter has to determine how they're going to hit the pitcher that's throwing at them, or hit the ball that the pitcher's throwing at them, because everybody's slightly different, and what's going to work for one person is not going to work for the other. And I thought that was a really good analogy, because it's true. Baseball's kind of all the same, but it's not. So one of the things that we have to consider looking at is when we talk about determinants and looking at all those people is, what is the physical readiness of the people that we're dealing with, whether it's patients or students or staff, where are their abilities right now? That's what the purpose of the gap analysis is. What is their emotional readiness? If you've got a new graduate versus somebody who's been there 15, 20 years, their anxiety level is going to be different, right? So, what type of support systems you have in place in your facility, whether it's for students or staff or even patients, to help support them emotionally, because not everybody's going to respond the same to the same stress level. What's their motivation, risk-taking behavior? What's their frame of mind? This is a lot to do, and we talked a little bit about this last week, but this is a lot to do, but these are all the things that we have to consider. I mentioned last week about the locus of control. Locus of control, remember, is, are they internally or externally motivated, right? And which type of personality would you rather have as a student? Would it be the external locus of control, the internal locus of control?
Probably external.
Adam?
I kind of like the internal.
Okay, and Tammy?
I'm agreeing with the internal.
Okay, so what's the difference between the internal and external?
Let's see.
If you were, Tammy, you're a manager, right?
No, I'm a pulmonary disease navigator. Just because I have an office, I'm not. I would probably. Yeah, but I have to share that office.
Yeah.
I would say I'd have to change my mind and say internal, because that means self-driven versus being acted upon.
All right, so
Right.
you're, as a navigator, and this works whether you're a manager or not. I mean, a navigator, you are managing, you're helping managing patients, so you are in effect doing that. You're trying to get at what is their internal motivation. Well, obviously, patients want to get out of the hospital, they want to, be able to manage their disease so they don't come back, et cetera. So, but there are some of those that we know rely on that external locus of control, where they're influenced by how we, whether or not we give them compliments or not, et cetera. And so are they more or less driven by those things? The people who have that internal drive, they're easy to deal with to one point. They can also be stubborn, because if they think they know what's best for themselves, they close down their mind. The external locus control, they might be more open to guidance. The problem is they might be on the other extreme. So it's going to shift a little bit depending on the subject, I think, personally. But readiness is important. Now, in the Lichtenthal 1990 broke it down that, and honestly, I don't buy this, but I'm just showing it to you. 25% emotional, physical, knowledge, experiential. Yeah, it's all going to be sort of dependent on the person, right? So you are going to have these four aspects that you have to consider, but it's going to depend on, somebody might be need more emotional support than some other people, right? So this is sort of generically, broken down into four equal parts, but the reality is nothing is this pat. But nevertheless, that's the way they presented this back in 1990. I just think we have to consider these things within that concept. So when we look at pedagogy and andragogy in this reference, then let's go to readiness to learn. Okay, so the pedagogical approach is students are told what they have to learn. So somebody with a very high internal locus of control would not respond well to the pedagogical approach. If they had the external locus of control, they probably would. So if you have a group of students or staff that like direction, they're not going to probably like the andragogical approach, because there's less direction, because we're going to rely on what they already know. And this is what sometimes is frustrating to students when you get them in their first year, because you want to push them to be independent, right? Because and you want them to be critical thinking. One of the things you want them to be when they get to clinical is you don't want to have to hand feed them, right? You want them to be in clinical, or if you're a staff member, you don't want a new staff member coming on and having to be hand fed. You want them to be driven or be ready to learn. In the study that I did on readiness to learn, I unfortunately wasn't able to measure the readiness at the beginning of their educational process, but instead I measured it after they completed their educational process and before they took their boards. And so what I did was I compared the national board results to their readiness scores. And well, unfortunately, I found no correlation, and that's the way it happens sometimes. But what I did find was that every single one, with the exception of 3 out of 100 of them, had a very high rating on readiness to learn, and their self-directedness was high, a very high rating. And why that was important was because a manager could take that information and look at it and go, I know where to put this person, because they thrive on change. They thrive on wanting to learn more, as opposed to the other ones. I think there's 3 or 4 of them that were on the lower part of the scale. I mean, it was an extreme. It wasn't there was a middle ground, but they were either at the top or they were at the bottom. And I was concerned about those 4 students or graduates, because I was, just the studies on readiness suggested that they may not be a good fit for a changing healthcare environment. So that's just an example of how all that comes together. But when you look at these these terms, it's not just about learning that not learning the terms itself, but what is involved in this. So let's go down to motivation of learning. All right, so motivation for learning, external pressures are what motivates them. So that means whether or not they get a good grade or not, right? Where internally they're just satisfied knowing they're learning. And you'll find that more the older the person is, the more you'll find that. But then again, you'll find those that are sort of in between. What I found was I found some of my older students tended to be perfectionists, and those were the baby boomers. And probably because they were career changing and they felt the need to make a change quickly, and so that's what they did. And to do that, they were very hard on themselves, as opposed to my younger students who typically it was all about the grades to them. They wanted to make sure they got an A, because that's how they were treated in high school. And that just sometimes, it was hard to get them to pull back and say, it's about the learning process, not, in other words, you've heard the term, it's the journey, not the, it's the journey, not the destination, right? It was hard to sell that to them. But when you can sell the idea that it's about the journey, you get the idea that they will, if they can buy into that, they will relax and just take it in. And it's a wonderful experience to see a student kind of relax into it and just learn. And then it's also frustrating when, all they're concerned about is whether or not they get an A or not. All right, come on. My transition slides are slow tonight for some reason. All right, so what I'm going to do, since I know we're running short on time, is we'll stop with part 3, and what I'll do is record part 3 and 4 for the rest of this and just post that along with what we're doing. But I did want to discuss briefly about the learning objectives. Is everybody clear on how to establish your learning objectives?
Pretty much so, but in sometimes depending on the particular subject, I have a hard time trying to come up with how I want it to, what I'm saying, how I want it to go or how I want to format it.
Okay,
to meet what somebody else can understand. Right.
So I think what's important is sometimes when we write an objective or a student learning outcome, it sounds like a goal, and you have to. I think what's really important is that you establish what is the goal for this project that you have in our course, or what is the goal that you have for your capstone. From the goal, then you can develop your objectives, how to get there, right? And ultimately, the goal is going to feed into your student learning outcomes that are established by the program here at Boise State. But your goal of where you want to go is going to drive how you're going to form those objectives. As I was talking to a student earlier this morning, I told him, if you've, how many objectives, let me ask you this question. How many objectives do you have? I've graded so many papers, I can't remember how many each of you have.
I'm
How
not
many do
really
you think?
sure.
3.
3? Did I
I
hear
would say,
3?
especially since I was dealing just specifically with equipment.
Right. Okay, that's right. Because you were doing the one with the patient. This is the one with the patients, right? That you were developing, if I'm mistaken.
Yes.
Okay. So yeah, I think.
I would have to say about 5. I don't know. Mine's probably somewhere around the 5 because I'm looking at different aspects of what I'm doing as far as the capstone is concerned.
Okay. Sometimes when you're writing an objective, sometimes they start sounding alike. Look back at them and see. So for example, if you're saying I want them to identify something, well, take it up a couple of notches and say if you want them to analyze. Terry, what's your project?
Mine's on adolescent vaping.
Okay, so do you want them to identify or do you want them to evaluate the effects of vaping on their health?
I was working on both actually.
Okay, but so you don't need identify. Why? Because you're taking a higher level to begin with. If you want them to analyze, they have to be able to identify. Okay, so
Right.
I think the mistake commonly is that we build all these objectives, but the reality is if you have identify how vaping affects the body, affects the lungs, but then you want them to analyze how it impacts their health, that's a much higher learning objective. And if they're achieving that, they're doing the other parts. Okay, so they're doing the identifying, and they'll remember it more because they're going to be learning about it as they go along, and it will stick more. Because the reality is if you're having a student in particular, now it was a little different with patients, but with students, you want it to stick. The more you can get them into the analyzing and application and creating phase, the more it will stick, and they will more likely be able to remember it and apply it. Because the most common problem is we give them a bunch of stuff and it's like, okay, I can't remember all that, and then we wonder why they fail. I've seen students who, very, very bright students who are, fall apart in the lab because in class it was, they understood, they could identify things, they could remember facts, but when they got to the lab, they couldn't figure out how to get their hands to do with the information. They didn't know what to do with it, and part of it was because, and this was my fault as much as it was our other educators, is that we would tend to focus on the theory so much that unless they got their hands on it, which brings in the kinesthetic aspect of it, unless they got their hands on it, they really couldn't put it all together. So we did a variation of flipping the classroom, where we would just take them to the lab, and we wouldn't even tell them why they were doing it. We would just say, do this, do this, do this, do this, and we would then make them repeat it a couple of times. And they were like, well, that's not that hard. I said, of course not. I said, now let's talk about why you're doing that. Because for adults, what do you think the one thing they want to know?
Hold on just a minute.
The why?
The why, exactly. They want to know why. They want to know what is the application. If you go into a math class of high schoolers, they're teaching them process, and they probably could care less as to why they're doing it. But you put an adult in there, and they're going to, oh, wait a minute, why do I need to do it that way? And they're going to break it down, because if they can get to the why, then everything else makes sense. Otherwise, it doesn't stick. So we have to get to the why. Sometimes we just have to get to the why differently. So you remember the who, the what, the when, the where, and the how. and the why. All of those questions have to be answered, but what adults want to know is that why exactly. So we have to gear our information to the why. Now, Tammy, you work with patients in a patient pulmonary navigator, so
Yes.
I'm quite certain you face that all the time. Well, why? Why? And it can probably be very frustrating, but at the same time, that's what they want to know. So how do we get there? So how many hours do you spend with a patient if you're getting them involved with their disease process? How many hours? I think in your paper you talked about, or in your journal you talked about a 3-hour time period roughly, or 3 sessions or something like that. Is that correct?
I'm not sure about that. Usually when they're inpatient, it can be anywhere between 1 to 2 hours.
Okay. And do you
outpatient,
feel like,
it can probably also be another 1 to 2.
okay, do you feel like that's enough time?
Well, heavens no.
How much time, if you had an ideal world, how much time would you take with each patient?
I'd say 4 to 5 hours probably.
Okay. I wouldn't disagree with that. I'd say probably 8, honestly. In teaching whole health education, which is part of something that I still do, one of the things I mean, you could get away with 6, but just because if you really want to cover everything, but less, a 3-hour, a 1 or 2 hour thing is just not going to do it. I mean, because you've got all of this information you've got to distill, and I don't know if I shared this with you, but when I was doing some of my clinical work with whole health education, and I had the patients that I was dealing with, what I would do is I would actually teach, believe it or not, I would teach them about mast cell degranulation. That's how involved it got. And most people would think, well, why would you teach them that? Well, it wasn't that I wanted to teach them that, but they kept asking why. So what I would do is explain to them why they're having their asthma attack, and what happens in the body. And I would make it really generic. I mean, I wouldn't get into all the the cytokines and everything, but I would talk about it in general. And all of them came away going, wow, I never understood that. Because they were given their medication, and these were adult asthma patients. They were given their medication. They were never given an action plan, ever. Out of all the patients that I had, that not one of them received an action plan from their physician. And it surprised me, but at the same time, it was exciting because they wanted to learn about their condition, and they did so much better by just knowing why that happens. Why did they have an attack? What they need to avoid. Because if they understood what was happening inside the body, then they better understood why they needed to avoid the trigger. And so I came at it a little differently, but I didn't determine that I was going to do that. I just based it on how they asked questions. And I said, well, let me show you, because they kept asking, and I thought, well, I'm not going to just hold back. And I actually really thought it was a lot of fun. And so I would actually just hand draw each one of them and go over the process with them, and they were going, okay, that makes a lot of sense. But I found out in that process, by getting to the why, you help solidify their learning. And that's where we have to get with indeterminants of learning. And I'll cover that in the next 2 parts. But do you have any other questions before we stop?
No, I'm good.
Okay. Well, I think everybody, I almost have all the papers graded. So there's a few that are outstanding that I haven't graded yet, and there's a couple people who haven't turned theirs in yet. So I think everybody has. Terry, have you turned yours in?
No, unfortunately, I'm one of the few that have not. I worked for the last 5 nights.
Oh boy. Well, just send me an email. Let me know when you're going to get it in, and
I will.
I appreciate
Hopefully
it.
tonight.
All right. Well, I appreciate y'all showing up tonight, and fortunately, we didn't have as many difficulties. Just lost to connection one time. That's good. So we will talk to you later.
All right.
Have a
Thanks,
good night.
Dr. Cross.
All right. Good night.
Take care.
You too.